While most total knee replacements lead to successful outcomes, recovery isn't always straightforward. Everyone heals differently, but pain, swelling, and stiffness are common challenges. Whether you're already recovering or preparing for surgery, this video will give you clear, practical steps to manage these issues and keep your recovery on track. Hey everyone, welcome back for another episode of Physio Show. Let's start off with what's completely normal after surgery: swelling and pain. Your knee has just gone through a major surgery, and some swelling is your body's natural healing response. But too much swelling can slow you down. It limits motion, increases discomfort, and makes it harder to progress your rehab. So what can you do to manage it? Try to keep your leg elevated above the level of your heart whenever you're resting, whether lying down or sitting. Pillows or a foam wedge work great for this. Elevation uses gravity to encourage fluid to drain away from the knee, reducing swelling and the pressure that causes pain and stiffness. Aim to elevate for about 20 to 30 minutes at a time, multiple times a day. Combine this with ankle pumps, flexing and pointing your foot, which is a simple but powerful way to boost circulation. By moving your ankle frequently, you activate the muscles in your lower leg that act like pumps, pushing blood and lymph fluid back to your heart. This reduces fluid pooling around the knee and helps prevent blood clots. Try doing ankle pumps for 1 to 2 minutes every hour while awake, especially during long periods of sitting or rest. I suggest considering compression socks, which provide gentle, consistent pressure to your lower leg. This pressure helps prevent fluid from accumulating in the tissues around your knee and ankle, reducing the feeling of heaviness and tightness. Wear them throughout the day and then take them off at night before you sleep. Make sure they fit well. Too tight can restrict circulation and cause discomfort, and too loose won't be effective. Make sure the compression stockings are not causing any numbness or tingling or increased pain. In this case, you might want to try a different size. Ice therapy is one of the best ways to control swelling and managing pain after activity. Apply a cold pack or an ice wrap in a thin towel to your knee about 15 to 20 minutes, especially after exercises or when swelling flares up. Cold causes blood vessels to constrict, limiting fluid leakage into the tissues and reducing inflammation. Personally, I love the use of a cryo wrap. It provides a deeper cooling and pain relief. You'll find a link to one that I recommend in the description below. Now, these strategies have proven to help manage pain and swelling, but doing them occasionally won't cut it. Consistency is key. Make swelling management part of your daily routine, and it will help reduce pain and support mobility and help you move more comfortably and confidently. Let's now move on to stiffness, one of the most frustrating parts of recovery. It limits your ability to walk, bend, and complete daily tasks. But here's the good news: motion is lotion for your knee. The first 3 months after surgery are a critical window for regaining range of motion. After that, gains in flexibility become much harder. But why is that? Well, this is because those initial 12 weeks, your body's actively remodeling tissues, pumping out swelling, and your joint capsule and muscles remain flexible enough to respond well to therapy. After this, tissues begin to mature and stiffen, making improvements tougher. So how do you stay ahead of stiffness? Well, stay active within your limits, frequently and gently. Avoid long periods of inactivity, which allows swelling and scar tissue to build up, stiffening the joint. Even short walks around your house or marching in place for a minute or two throughout the day can keep your joint mobile. This frequent movement pumps synovial fluid into the joint, nourishing cartilage and preventing adhesions. Another key is to commit to your prescribed flexibility exercises. These aren't just homework, they're an essential tool to maintain and increase your knee's flexibility. Skipping even a few days can allow tightness to set in and undo your progress. Aim to do these exercises at least 3 to 4 times daily, with multiple repetitions. Excessive pain discourages you from moving your knee, increasing stiffness risk. If pain limits your motion during exercise or daily activities, talk to your healthcare provider about optimizing your pain management strategy, whether adjusting medications or timing around exercises. And once swelling is controlled, gentle heat may help relax tight muscles before movement. Consider low-impact alternatives like stationary cycling or water therapy to keep moving without stressing the joint. Now remember, mild discomfort during your exercises is completely normal. It means your tissues are adapting. But sharp pain or sudden swelling is a warning sign to ease up because you might be overdoing it. By prioritizing frequent, gentle motion and managing pain well during the critical early phases of rehab, you give your knee the best chance to regain smooth, functional movement and avoid long-term stiffness that can really set you back. Now, do you have any questions about your recovery? Maybe you're stuck or at a plateau, or unsure if certain pain or symptoms are normal. If so, click the Ask the Experts link below. I'd love to hear your story and help you move forward with confidence. Now let's dive back into our key tips and strategies. Now once pain and swelling are under control and mobility is improving, it's time to focus on building strength. Right after surgery, it's completely normal to feel like your leg isn't working properly. Your quadriceps may feel asleep, movements are awkward, and muscles are reluctant to activate. But here's a fact that many don't realize, that weakness didn't just start after surgery. For many, muscles around the knee have been declining for years due to pain, disuse, and compensations. So when you're recovering, you're not just bouncing back, you're rebuilding from years of altered movement and guarding. And strength is key to long-term functional gains. Your quadriceps, glutes, and hamstring muscles act like shock absorbers. They protect your new joint, improve balance, reduce strain on your implant, and give you more independence for daily activities like walking, climbing stairs, and getting in and out of a chair. Early on, especially the first 1 to 2 weeks, focus on gentle mobility and swelling control. As pain and inflammation settle down, typically around the week 3 to 4, start incorporating more targeted strengthening exercises. I suggest tracking your improvements as well, whether it's measuring how flexible your knee is, logging exercises, or noting how far you walked. Seeing progress and writing can really boost motivation, especially on the tougher days. And if you want to speed up your muscle recovery, especially early on, consider neuromuscular electrical stimulation, otherwise known as NMES. Research has shown when paired with exercises, NMES can lead to faster strength gains and better long-term results. I've included a link in the description to a user-friendly device I recommend. Now, recovery isn't just physical, it's mental too. Some days your knee will feel stiff, your energy will be depleted, and progress seems almost impossible. Motivation dips are normal and happen to everyone. The key is to have strategies ready to keep moving forward. Now, so set short, realistic goals. Big goals like walking a mile or bending fully can feel overwhelming at first. Instead, break your recovery into manageable milestones. Walk to the mailbox today, aim for 5 more degrees of bend this week, or add a few reps to your exercises. Small wins build momentum and keep motivation steady. And celebrate every bit of progress. Document your achievements, photos, videos, step counts, or sharing with friends or support groups. Recognition, even from yourself, fuels motivation and reminds your effort matters. And keep a big picture perspective. Think of recovery like the stock market in a long-term bull run. Zoom in and you'll see ups and downs, breakthroughs and setbacks. Zoom out over weeks or months and the trend is clearly upward. This mindset helps manage frustration and maintain patience. Because with rehab, progress is not linear, and setbacks don't mean failure. Consistent effort over time leads to real improvements. To sustain motivation, build your exercises and self-care into daily routines so they become habits, not just chores. Use reminders or alarms to keep on track. Regularly remind yourself why you're recovering, whether to play with the grandkids, return to your favorite hobby, or gain independence. Every bit of effort counts, even on those tough days. Staying consistent, patient, and trusting in the process, bumps and all, is what leads to lasting recovery and a stronger knee. You've got this. Your mindset is one of your most powerful rehab tools. Pain, swelling, stiffness, and weakness are all part of the rehab journey, but they don't define your outcomes. With the right strategies, a consistent routine, and a resilient mindset, you can rebuild strength, regain your range of motion, and get back to the activities you love. If this video helped you feel more equipped to handle your recovery, hit that like button, subscribe for more rehab tips, and leave a comment to keep the conversation going. And stay tuned for the next episode of Physio Show, where we teach you everything you need to know about your body, how it works, and what it needs to keep moving.